part of the programme. It's been designed by the people at BJPsych Bulletin, so the British Journal of Psychiatry Bulletin, for anyone who is not a practitioner, is not an expert, who is in the audience. This session is going to be chaired by Dr. Cate Bailey, there's a special edition of the journal. There's a publication on climate and mental health, which is accompanying the conference today. It gives the latest understanding of the impacts of climate change. So I'm going to hand over to Dr. Cate Bailey to shepherd us through the next session.
Okay, diolch yn fawr iawn. Thank you so much for having us alongside this conference today. So I'm Cate Bailey, I'm a psychiatrist and I'm a member of the editorial board at the BJPsych Bulletin. Really grateful to RC Psych Wales for their invitation to collaborate in this conference and really proud to represent the Bulletin. I've got two fantastic speakers with me who I'm going to introduce shortly, Anushka Gross and Dr. Shou Zhang. But first I wanted to give you a little bit of background to the special climate issue that we did. So I'm just going to try and share my screen because we have such lovely graphics. I don't want people to miss out on them. So just checking that that's up. Hope everyone can see that. Fantastic. Because I think, you can judge something by the cover sometimes, which is important when it comes to journals for sure. So just I'm mindful that we're speaking to kind of psychiatrists, but also a very wide audience today. And just to explain, sort of the Bulletin is one of a suite of journals that's published by the Royal College in partnership with Cambridge University Press. And our remit is to kind of think about the state of psychiatry, to offer informed reflection on services and education and training. And we're well placed to be in kind of dialogue with our membership because all members of the Royal College receive the journal, but also because we're an open access journal, meaning that we're not behind a paywall, anyone can read it. So that means that we can have potentially a dialogue with people who may use mental health services or, are just working alongside psychiatrists in a multidisciplinary team. And we've had full text downloads of more than 1 million papers year to date and over 20,000 altmetric mentions. And in August this year, we published a special edition on the climate emergency and its relationship to mental health. And we had an editorial with myself, Editor-in-Chief Norman Poole and Adrian James, Royal College President, who you'll hear from later. As well as a number of, fantastic special guest editors as well. And I'll talk about that a little bit more later. But just to give some background to kind of why we did it and some of the kind of things that we thought were important to communicate. So I think everyone here agrees that the climate crisis is a health crisis and indeed a mental health crisis. And it's been described by The Lancet as the greatest threat to global health of the 21st century. And as such, it demands the urgent attention of healthcare professionals and organisations. And we share this view with the UK Health Alliance on Climate Change, of which our own college is also a member. So we wanted to kind of bring together some informed reflection on the mental health effects of the climate crisis and also think about what psychiatrists and mental health services can do. And one of the things that's become increasingly clear is that although there's kind of an increasing awareness of the physical health effects of climate change, there remains a lack of understanding of the mental health effects. So I'll just share a picture from the Grantham Institute briefing, which looked at the kind of reporting and academic reporting on mental health and climate change. So you can see that there's, as expected, a large number of papers on mental health and a large number of papers on climate change, but not that many that kind of bring those two together. And, it's really important that we do think about this, but, even things like the Lancet countdown on climate change and looking at kind of tracking change has acknowledged in their most recent report, which was launched this week, that they haven't really got to grips with the kind of mental health effects. There's problems with how things are reported, how they're understood in different countries, and so on. So there's much more work to do. But we felt that it was really important that psychiatrists of all specialties understood the mental health effects of climate breakdown, and that there is a role for academic publishing in kind of communicating data and sharing information. And we can think about the mental health effects in terms of the kind of direct effects of extreme weather, warming, habitat loss, and the slower but kind of no more less devastating grief and distress that is kind of in response of what's being witnessed and the worst to come. And we've kind of touched on this, and Sho will talk more about this, but the consequences of ecological destruction fall first and worst on the most marginalised people, the people who are living in poverty, those with severe mental illness, older people and children. And climate and environmental justice is linked to racial justice globally, as the most significant effects of the crisis are already being felt by Indigenous people, those in the global South who were already disadvantaged by colonialism, extractivism, and who of course played very little role in actually causing the problem. But thinking kind of closer to home, those of us who are working with older adults, as I do, need to be aware that in the last 20 years, heat-related mortality in people over 65 has increased by more than 50%. And the Lancet Commission for Dementia recently highlighted that air pollution accounts for 6% of the modifiable risk for dementia. Suicide prevention is a major focus in mental health services, but it's also vital that we understand the relationship between suicide and heat waves. In the Grantham report, analyses suggest that there is approximately a 1% increase in the number of suicides for each 1% temperature increase, once the temperature passes a threshold that's unique to different locations. And the exact relationship does depend on a whole host of contextual factors like humidity and demographic variables. But researchers estimated that if climate change continues as it currently is, rising temperatures will lead to 22,000 extra deaths by suicide across the United States and Mexico alone by 2050. For our current people that we're seeing in mental health services, people with severe mental illness are 3 times more likely to die in heat waves than the general population. Psychiatric medications affect heat regulating function, and lithium in particular, which is one of the medications that's prescribed a lot for bipolar, a very effective treatment, can easily reach toxic levels in a sudden heat wave. And long-term exposure to air pollution is related to depression, and in the short term with suicide. Dr. Zhang, who will speak later, has also been involved in a meta-analysis looking at that. And a recent BJPsych paper highlighted that residential air pollution is related to health service use for people with psychosis, so how often people need to be admitted to hospital, how much they use emergency departments. Trauma is of course related to severe weather events. PTSD related to flooding, fires, rates of around 30% of PTSD after major kind of environmental disasters. And indeed, the psychological consequences of disaster outweigh the physical by about 40 to 1. And we've heard so eloquently from Poppy already today, and from Catherine, CAM psychiatrist, about the kind of impact on young people's mental health and well-being. And even beyond the IPCC report, a recent preprint paper in The Lancet from Elizabeth Marks and Caroline Hickman has really been the largest study of kind of eco-anxiety, around 10,000 responses, and found that 84% were at least moderately worried about climate change, and 45% found it affected their daily life. But really importantly, they were able to kind of try and unpick some of the dynamic factors with this, and the rates of anxiety and distress were related to perceived government inaction and betrayal. So that tells us also something about what we need to be doing. And as doctors and people working in health services, it's probably less about individual action and more about how we can communicate the scale of the problem, the evidence of impact on health and the potential improvements of health with a just transition. But it is important that we're aware that the NHS is actually the single largest source of greenhouse gas emissions in the UK public sector. And the Greener NHS report sets targets for a net zero NHS, and it makes it a responsibility of all staff, which of course, on top of an already struggling NHS is something of a big ask. Although it's also really important to understand that the things that are listed from the 10 points that psychiatrists can get involved in, all of these things are things that will improve the health of our populations, improve the experience of staff and patients if we do them right. So there is a lot to be gained as well in terms of kind of whether we source food more locally for our canteens and our patients, or active transport or remote consultations. So the issue that we will link to in the chat and so on includes papers from child and adolescent psychiatrists, psychologists, young climate activists, psychoanalysts thinking about unconscious mechanisms which might underpin the lack of action on climate change, underpinnings of conspiracy beliefs. We also heard about the potential of green care, how psychiatrists can get involved in sustainability using co-production and quality improvement. And we were very pleased to collaborate with Adrian James, who you'll hear from later. We're very grateful to our contributors and peer reviewers, guest editorial board, which included Norman Poole, Anushka, who you'll hear from as well, Dr. Neil Armstrong, Harriet Stewart and Nitin Gupta. So I'd like to introduce our speakers now. We're really sorry not to be joined by Neil Armstrong, who sends his apologies. You will have seen him on an earlier version of the programme, but I would very much encourage you to take a look at his paper with Kira Pratt-Boyden on how mental health activism can help us navigate wicked problems, of which climate change certainly is. But I'm very, very pleased to introduce Dr. Shou Zhang. She is a specialist registrar in child and adolescent psychiatry in Northwest London. She's an honorary research associate with the Department of Child Psychiatry at the Institute of Psychiatry, Psychology and Neuroscience. At medical school, she intercalated in politics, social psychology and sociology, and subsequently undertook an MSc in global health. And her academic interests focus on how we can improve clinical care through a better understanding of the social and environmental determinants of health. She's a member of the group that Catherine also mentioned earlier, the Planetary Health and Sustainability Committee at the Royal College of Psychiatrists, and she contributed to the college position statement on the climate emergency. Our second speaker is Anushka Gross, who is a psychoanalyst and writer practicing in London. She is a member of the Centre for Freudian Research, where she regularly lectures, and she's written a lot of non-fiction, including the most recent book on eco-anxiety, which of course is coming up backwards, but I would highly recommend, which she will speak kind of broadly to later. She has also written a lot of fiction. She writes about art and fashion, contributes regularly to The Guardian, Radio 4 and Resonance FM. And she was a guest editor. We were very lucky to have her contributions to the climate issue, as well as a judge for the Praxis Editorial trainee competition. And she's also been recently interviewed by Claire McKenna in another recent issue of the BJPsych Bulletin, which we'll link to. So how we're going to do it is we're going to hear from our two speakers, and then we're going to have plenty of time for a kind of panel Q&A. Please pop your questions in the Q&A as the speakers are talking, and I'll pick them up later. And if nothing comes through, I've got so many questions for them, so I don't think we'll have a trouble filling the time. But I'd first like to invite